Okay, she's rushing.
Hello, everyone, and I got a treat for you today. I have got Dr. Bill Saunders joining me today, author of What Happened, What Mental Health is Really About. Welcome, Bill.
Good morning.
It is so wonderful. We have been talking about you on our Weaverbird show. We've been talking about you all week in all of our groups and about this amazing book and how it's changing the conversation around mental health. And we had an amazing launch last week, didn't we, Bill?
Oh, look, I was so apprehensive beforehand. I didn't know how it was going to go, but thanks to you and the way you ran it, it was one of the best nights of my life.
Oh, see, that's what we like to do, is have a beautiful experience and memories to go with it. It was amazing.
No, it went really well. Yeah, and actually, I've got lots of lovely feedback. I mean, obviously, my colleagues and friends were there, and I've got lots of very positive feedback from people who bought the book on the night and have read it. Even my next door neighbor came over this morning and said, I haven't put it down. So look, it's that sort of spontaneous feedback, which is enormously gratifying.
Oh, Bill, do you know what? I've been watching it on the Amazon charts, and it's just hit number 2 on Amazon charts. Wow. So we're going for number 1 today. So if you're watching, go grab your copy of What Happened on Amazon and help us to get to number 1. So we'll give that a little push today, and hopefully you'll be a best-selling author by the end of the day. Hey, that'd be great, wouldn't it?
Well, that would be absolutely phenomenal.
But you pulled at our heartstrings. You pull at our heartstrings with this book, and quite often it's a taboo subject. You know, I before I became a publisher, you know, I studied humanities, and I actually worked in mental health for 4 years. Would you believe it? And so, you know, I understand how things happen and things like that, and how you can get stuck in a system. And that was my concern. That's what I kind of got out of it. I was like, so many people are being defined by things and getting stuck in a system, and I thought it was unnecessary. There was no hope there. And you're having a different conversation. Can we share some enlightenment from the amazing insights from Dr. Bill Saunders?
Okay, look, we have a crisis in mental health. And you see it, I mean, the Australian federal government has just tipped an extra $3.2 billion into mental health. And it sounds as though the crisis is about lack of resources, but actually it isn't. In my view, and of course in the argument in the book, is that what is being done, the wrong paradigm is being followed. So we need to introduce a different paradigm into the management of mental health. So the what's wrong with you model, I think, is inherently wrong. So you turn up, you see a mental health professional who would diagnose you with one of 250 purported mental illnesses. Now, I've got real great troubles with that, because the 250 so-called mental illnesses, there's not a single biological blood test for any of them. Right, so every diagnosis in psychiatry is nothing other than an opinion. I think you've got schizophrenia. I think you've got bipolar. I think you've got alcohol dependence. But the issue here is that opinions vary. So the inter-rater reliability in psychiatric diagnosis is so low that if you see 2 psychiatrists, you're almost definitely going to get, well, you've got a 60% chance of getting 2 different diagnoses. And if you go and see a third one for a third opinion, you're almost guaranteed to get 2 diagnoses that contradict each other, and you might even get 3. So the diagnostic process is totally unreliable. And the problem is, because there is no biological evidence about any of the mental illnesses, including schizophrenia. Now, we like to say depression, or people do like to say depression is caused by low serotonin levels. But there's no evidence for that whatsoever. It was a theory in the 1950s. It's still around today, but there are no blood tests. In fact, all the evidence is that when you look for low serotonin levels in people with depression, you can't find them in any way, shape, or form. So here we have an issue. We've got an argument that A, we can diagnose you, B, we will diagnose you with one of 250 disorders which do have a biological base which we haven't found yet, and then we will give drugs to actually change your brain chemistry even though we don't know that anything is wrong with your brain chemistry. So we will change your brain chemistry with a drug we give you. No wonder we've got a crisis in mental health, and it doesn't work. If it really worked, if the pills for every psychological ill worked, then surely people wouldn't keep on coming back. When I was working on one project a few years back, I actually realized that the length of time people stayed out of an acute psychiatric ward in Fremantle was 8 days. Now, so that's just that spinning, revolving circle. So, I mean, there's other problems in all this. So they can't diagnose reliably. They give you pills for supported biological ills for which there's no evidence. But also, if you've got 250 illnesses, but you've only got 6 or 7 interventions, there's only 6 or 7 different things psychiatrists can prescribe. So we've got 250 supported biological illnesses with only 7 treatments. I mean, that's just bizarre.
Yeah.
And on top of all this, antidepressants aren't antidepressants. They're actually serenic drugs. They make you serene, which is not necessarily helpful, because after you've been on them for 6 months or more, you're so serene you end up in the land of blur. And if you try to come off them, you get withdrawal symptoms and you end up in the land of grr, because you're so irritable, because, you know, withdrawal effects are always opposite to the effect of the drug. Not only this, if you look at the burden of mental illness in our society, if you take alcohol and drug problems, anxiety, depression, and personality disorders, that accounts for 90% of all the psychiatric presentations in a month. So 90% of those presentations, of all psychiatric presentations, are made up by 4 major groups. The trouble is, I think all of those things are a consequence of what happened to you. So rather than going in with what's wrong with you, I think we need to start talking to people about what happened to you. And if you ask that question, you get a very different answer. And it might be appropriate if I just read the dedication at this point. How does that go?
Go for it. Go for it.
Okay. This is a totally true story, and it was just remarkable. And I'll read. On the day I finished writing this book, the front doorbell chimed. I opened the door. There was a gentleman standing there. My name is John, and I have a disability. And could I clean your windows? But don't hire the disability, hire the window cleaner. So I did. As he worked, I asked him about his disability. I'm a schizophrenic, and I take a drug called Risperidol. I take 7.5 milligrams every day. Do you know that drug? He said. Yes, I said, I do. How do you find it? Well, it makes me fat, but sort of stops the voices. He paused. What do you do? I'm a clinical psychologist. It's funny, isn't it, he said, that nobody knows what causes mental illness. I said, I do. He looked at me astonished. He said, and I said, what happened to you? He hesitated. Then he replied, when I was 6, my mum ran away from my violent father. For the next 6 years, I was locked into my bedroom. My dad never let me out of the house for 6 years. Is that what caused my schizophrenia? I said, yes. We know that really nasty childhoods like yours cause schizophrenia. He said, thank you. I never knew that. So the book is dedicated to improving the understanding of the impact of childhood trauma upon psychological functioning, and therefore, hopefully, we'll move away from a flawed paradigm which doesn't work, hence our mental health crisis, and replace it with a more humane, more connected, more involved with individuals, where we use trauma-informed psychotherapy.
Mm-hmm. That story gets me every time, and it's just an absolute for the book to be dedicated to that essence. It just shows that one question you give that you give John the answer that he needed to hear.
Yeah.
But, you know.
Yeah. Well, I didn't like to tell him he probably didn't have schizophrenia. What he had was the consequences of being locked in the house for 6 years with a violent father, and that the antipsychotic he was on was probably doing him more harm than good. It wasn't just his overweightness. I mean, antipsychotics cause diabetes, they cause heart disease, and he actually was missing teeth, a consequence of being on antipsychotics. So here's a drug that antipsychotics are one of the most toxic group of drugs given to any human beings. Never mind chemotherapy. Antipsychotics are right up there. And the other problem is they're not antipsychotics. They're not anti-schizophrenia. They're brain-seizing drugs. So all they do, they seize your brain up, and it's like running your car with the handbrake on. So not only can you not think so well as you did, the voices don't get turned off. It's more like a dimmer switch than an on-off switch. So all that happens is they seize up your brain, and then the voices get turned down. They're still there. So why not do things differently? Why not engage with people who have voices? And instead of seeing that as a wrong response, and this is what happens with the what's wrong with you model, anxiety, your depression, your alcohol and drug problem, or even voices are deemed to be wrong. So they're deemed to be things that need to be treated with a pill to get rid of them. But what if they were right? What, from a trauma-informed perspective, what you say is your anxiety is right. I saw a young man yesterday afternoon, and he came and he sat down and said, I'm very anxious. I do not understand why I'm so anxious. And I said to him, he said, I don't know what's wrong with me. And I said, well, let's just assume your anxiety is right. I said, what threat are you facing? And the story slowly came out. He was 26 years old. He's living with his mum and dad. He's got a girlfriend. He's almost finished his apprenticeship. So here he is at 26, and he's not quite made it yet to being an independent adult. And he actually said the most telling thing: I want to become my own man. But he's trapped at home with a very caring parents, but they control him. They control his money. They control when he eats his dinner and so on. And he's 26. But he can see that on the horizon, his apprenticeship will finish, his girlfriend, he might be able to get himself a rental once he finishes the apprenticeship. So his life, I want to be my own man, is visible. He just can't get there yet. And we always get more anxious when something we really want, we can see it, but we can't get there. By the end of the session, he wasn't anxious. Yeah. And the interesting thing about this was, if he'd gone to see a doctor, a GP or a psychiatrist, they would have prescribed him an antidepressant. Now, ain't that weird? We've got drugs called antidepressants, and the group of people they're most commonly prescribed to are people with anxiety. Yeah. Now, that clearly doesn't make sense. That's like me taking an antibiotic for my hypertension. It's nonsense masquerading as psychiatric science. And increasingly, I think the psychiatric emperor has no clothes, or very few.
Oh, goodness. Can I ask you one thing? Do you think that creating a great, and what happened creates an understanding through stories and through case studies, it creates an understanding as to why, not the what's wrong with you, formula, it's the opposite, and like, for example, whenever I had my son, he's full of anxiety, so I brought him to a doctor. Straight away, I was offered pills straight away without any kind, straight away, and we rejected them. I decided to choose love and nurture it, love him out of it. And that was just my way of doing it. He still struggles. He's just, those kinds of things. But I chose a different alternative, because I think whenever you create an understanding and an awareness as to why, there's no fear in that then, because it's the fear of not knowing. It's the fear of what is wrong with me that creates anxiety as well, doesn't it?
I know, you see, and people come along to me and they'll say, I'm depressed, you see, and I instantly don't think of biochemistry and low serotonin or naughty transmitters that don't work. I immediately think, depression is a prison in which you are both the pitiful prisoner and the cruel and inhumane jailer. So why are you being so bad to yourself? Now, what you find in depression is people have learned in their childhoods to give themselves away. So they're very good at being good to others, but they're not good to themselves. So in the heart of depression often is lots of odious comparisons. And they may have even been brought up with odious comparisons. You know, see that little boy over there? He's much better behaved. See how nicely he's sitting there? So all of that leads the person to become their most, you know, they are their most highest critic. And so what I have to do when working with people with depression is move them away from being critical of themselves into being their own cheerleader. Yeah. And that is what the management of depression is about. So depression is caused by your relationship with yourself and with others. And I often say to people, stop being so good, stop going around being kind, practice random acts of meanness. And they burst out laughing, but actually they eventually get it. And I say to them, okay, here's your homework for the week. Psychologists love setting homework. People don't usually do it, but it's just a game we all play. But I say to them, I want you this week to say, me first, fuck the rest. And their capacity to do that is often enormously limited. They look at me as though I have said the most outrageous thing in the world, that the idea of making themselves the priority is anathema to them, which is why they are depressed. Because if you do not make yourself the priority, then why should anybody else? And the notion that if you go around being good to others, somehow they will reciprocate goodness back is a depression myth. And lots of people with depression believe that. And the truth of the matter, of course, if you go around being nice to everybody, you just get exploited and taken advantage of, which is very depressing.
Yes, it is. And it's so refreshing to hear you say this openly, because this conversation needs to be heard far and wide, whether people want to hear it or not, you know, and have ownership of you know, and know that if you educate yourself and understand yourself enough, that you can heal through anything. We have a comment here, and Boris Walter says, hi, Karen. What Bill is saying is the future of therapy. The market, the people demand a depth approach to understanding mental illness. As Norcross said, we need to work at relational depth with our clients. Do you agree?
Absolutely. Absolutely. Look, it's the relationship in psychotherapy that heals. Right, and that's a quote from Irving Yalom, who's probably one of the best psychotherapists in the world. And what you have to do, look, what children need to be mentally well as adults, they need a primary caregiver who is playful, spends time playing with them, who is overtly loving and tells them they are lovable. Because a lot of the patients, particularly those patients with so-called borderline personality disorder, don't have borderline personality disorder at all. What they've had is not enough of the right stuff in their childhoods and too much of the wrong stuff. So 90% of people with the label borderline personality disorder report being sexually abused or other forms of abuse. Yeah. And this is, you know, across all the so-called 13 different personality disorder types in the good book, in the Psychiatric Diagnostic Bible, when you actually factor analyze that and look at it, they're all different versions of borderline. Now, we need to stop talking about borderline personality disorder and start saying, what happened? And so kids need playful, loving, accepting, curious, and empathic caregivers, primary caregivers. As a psychotherapist, I always say to my any psychologist I'm supervising or teaching, I always say you need to ACE it. So when you see a client for the first time, ACE it. So you're accepting, curious, and empathic. Now, later on, you can follow Anthony Storr's advice. Anthony Storr, the British psychiatrist who died, and in his lovely book, The Art of Psychotherapy, which came out in the late 70s, he actually wrote, before I go and see a client for the first time, I sit in my room for a moment, and I think, and I see written on the door as I go to greet the client, what is it about this client that I can love? Now, when you say that to clinical psychologists, they go, love? Well, we're not going to love them. And I go, no, but you're going to look for something you can love. Well, how about like? And I go, no. The essence of psychotherapy is finding in the patient something you can love, because that, finding it, and you don't have to find it, but you do have to look. If you look, the patient feels it. The patient feels they're in a place of empathy, acceptance, where you're curious about them and you're loving, and then you can start being playful. And that, you know, when therapy is working because you can tease and play with the patient a bit. So somebody came in this week and I said, I always start a returning patient. I always say to them, how's your world? And the patient said, my world is good. And I said to her, oh, we can't have that, can we? And she burst out laughing. Now that, you know, when therapy is working, because you can play a bit with people. You can tease them. You can actually engage in them, in actually seeing, rather than taking their lives so seriously, and what Aunt Jean said to Aunt Mavis totally destroys them. Suddenly they get a sense of lightness. They get a sense of, hang on, you know, if I care about myself, what other people think doesn't matter.
Yeah.
And once you get to that stage, you're recovering. So yeah, what we need to do in therapy, what we need to do in psychotherapy, is actually to recreate a space which is almost like reparenting. So they actually experience what it's like to have someone who is playful, loving, accepting, curious, and empathic. And once they do that, they then connect. And as they connect, right, they suddenly go, ah. Now we know in trauma, kids who've got trauma, who have not enough of the right stuff. Now, here's an important issue, which is about neglect. Often people write that it's the sexual abuse or physical abuse, which is the worst thing, but I'm not so sure. I actually think neglect is the worst thing. And one patient once said, she said, it was the grey, empty days of neglect that drove me crazy. The sexual abuse, not so much, right? And I think she's right. So if you get neglected as a child, right, you have no sense of being. You feel empty. You don't know who you are. And again, coming back to borderline personality disorder, so-called, a lot of people with borderline personality come along and say, I don't know who I am. I'm empty. Now, what therapy does is allows connection. Now, the kids who get neglected, the kids who get abused, actually, their brains get wired for protection. So the brain is expanding hugely in the first 2 years of life, and everyone gets wired up differently. So what you've got kids who get wired up for protection, whereas the kids who are getting nice childhoods are actually being wired up for connection. And this is why people who've had traumatic childhoods don't do very well in adult relationships, because usually they pick somebody else who's also wired for protection. So here you've got two people wired for protection. So connection for them, when it happens, is extremely vulnerable. They actually find connecting to be scary. And the reason it's scary is because it's what they crave for, but it could be taken away. Right? So as people connect, then so their sense of vulnerability goes up. And as their sense of vulnerability goes up, their brain does what it does as a kid. It turns it off and it turns towards protection.
It's just fascinating. And one of the things where there was an article you requested for you to comment and give 5 top tips or something about parents and children. And what I loved what you said was that it's often the children who least need, that least get, that are being naughty really, that need the love the most.
Yeah, so it's the maxim that every parent needs to hold on to is kids need love most when they appear to deserve it least. Yes. And I've got a beautiful example of this. I was working with a gentleman who had a tricky childhood, and he got so far in his career, but he was getting stuck and he was feeling a bit left out. But previously, some 3 or 4 years earlier, he and his wife had adopted two boys who had been traumatized, and so he adopted them, which was it's a brave thing to do. And he adopted them, and initially it was terrible. These kids were just feral, but slowly, they trusted the environment, they trusted the routines, and they started to rewire their brains for connection. But the trouble is, as you're rewiring your brain for connection, things can trigger you. And one day, my patient had gone home, and he heard this terrible noise coming from one of the boys' bedrooms. And he went in, and his son had a baseball bat in his hand, and he completely smashed his room. Everything was shattered. The glass windows were shattered, the mirrors were shattered, the bedside table was shattered. Everything he could break, he had broken. And he was standing there shaking with this baseball bat. And I said to my patient, "What did you do?" And he said, "I walked up to my son and I hugged him and I said, 'I love you.'" And I thought, my therapies work very well with this man.
That's such a powerful story, and
look, it's a superb story. Every time I tell it, I have trouble not swallowing hard. But to be fair, it's exactly what we probably all wanted when we were kids. And it's exactly not that when you don't get that, which of course makes your wiring for protection gets stronger.
And life is all about connections and interactions, and that's how you grow through that. So if you're unable to do that, then you feel out of flow, and your growth doesn't happen to the best of its potential. Boris has connected. He said, "Thank you for speaking your truth, Bill. You know what I mean when I say you are very brave for inquiring beneath the disorder." And Dr. Bill is very brave, and I absolutely commend him. And that is why I am here on this mission with you to change the conversation around mental health. And I think that Boris is on that mission as well. Well, I know Boris is, because I've had many conversations with Boris, and he and you actually have to meet. You're both Perth-based, and you both talk the same language. And he says, "Does Bill supervise master students of psychotherapy for placement?" And a big smiley face.
Well, the answer to that is actually yes. I mean, the funny thing about all of this, I actually retired and then wrote the book. But instead of going traveling because of COVID, instead of doing what I was going to do next, which was just take a couple of years off traveling around the world, I was suddenly confronted with a completely empty 6 months. So a year ago, I started doing a little bit of psychotherapy, and in about a month's time, I'm going to open up with my wife a small psychotherapeutic practice in West Perth. So I'm back in a little bit of business. But I love supervising students. It's always great fun, and I like watching it all unfold. And in fact, the finale of the book is delightful. The finale of the book is a very weird. It's a story which is totally true about a very weird group that I was running, and I won't tell the story. But what was lovely, one of the people in there. Right, one of the patients in that group, when she wrote me a letter about the group subsequently, and then I got an email about 2 years later saying, "Bill, thank you. I've just qualified as a clinical psychologist." And yesterday I had my first supervision session with her as a clinical registrar, and look, it was delightful.
Yeah,
and that is what recovery is all about. It's going from being an inpatient and then a day patient, and because of trauma-informed psychotherapy, she's now out there doing her own trauma-informed work.
Isn't that amazing? It's amazing.
Yeah, it's a good story.
That's an amazing story. Well, I will connect you and Boris up. Boris and his lovely wife Yasmin are actually shareholders in KMD Books, so I'm going to connect you up if that's okay. So you can have a bit of a meet and greet. You're going to be fascinated by this amazing person, so I'll connect with you. But do you know what? This is only the start of the conversation here. We're going to share this far and wide, but thank you so much for coming and sharing and for showing up and for giving us the privilege of being able to help you get this book out into the world, because I think it's time. Well, I know it's time, and you know it's time. Yes. So let's do it. Let's get it out there. And everyone who's watching this, let's keep the conversation going. Gone is the taboo of mental health. It's time to face it and help it evolve to the next, to get rid of this crisis that we have, because it affects us all, whether we like to admit it or not. It affects us all. It affects people that we love and people around us. It affects our environment that we live in. So let's do something about it, because it's a crisis here in Australia, especially. But
it is, and what we don't want to do is tip more money into a wrong model, and unfortunately, that is what's going to happen.
Yeah, that is so important. Absolutely. Bill, thank you so much. As always, I learned so much from our conversations. I get so pumped up to make this change happen. So thank you so much for showing up, having the conversation with me today. And guys, let's get this book to #1 today so that we can get a bit of recognition out there and get it out further. You know, what happened is the book to get today. So thank you so much. And Bill, thank you so much. Do you want to say anything to everyone before we leave?
Look, it's been a privilege to have time to write the book. It's been a delight working with you to get it out. And look, I would love it. I mean, I would love if it changed the world. Books don't change the world, but they do start the ball rolling. And of course, the most interesting thing about this is that there's a woman in America called Oprah somebody or other, and she, with a brain scientist, has just written a book called What Happened to You, which is a coincidence, but it's not a random coincidence. Here we have, on the opposite side of the world, two people coming from different perspectives agreeing. So I think her book, which is largely about children and traumatized children, is actually complemented by my book, or should I say it around the other way? Her book complements my book very nicely. And look, it would be lovely if that book and my book could actually lead a revolution where the emperor with no clothes is replaced.
Yes. And watch this space, because that's all in motion. It is all in motion. It is not a coincidence that these two books that neither knew was being written,
correct,
come out at the same time, are complementary, and both have, you know, quite similar titles. It's not a coincidence. It's because the time is now for this change to happen. So yes. I am excited, and thank you so much.
Okay, thank you, Karen.
All right, bye everyone. Thanks for joining us, and thanks for watching.